I'm Dr. Patrick Andersen. Did you know 6 in 10 Americans have a sleep disorder at some time in their lives? On any given night, 1 in 3 Americans sleep very poorly. 1 in 10 have chronic insomnia. 9 million Americans take sleeping pills. Sleeping pills are known to have many side effects and can be addictive. Sleep is supposed to be a time of rest, regeneration, and repair. But for all too many, poor sleep leads to fatigue, frustration, and poor performance the next day. Sleeplessness can lead to depression, anxiety, and leave you accident-prone. Waking up feeling unrested is hardly a good start to your day. Are you one of those people? Do you know the best sleep positions, pillows, and spine support? Are you progressing through the stages of sleep well? To learn more about sleep science, sleep hygiene, and to catch the Z's you need to be well, join co-host Stacy Hansen and myself for the next half hour on Maximize Living to maximize your sleep and your life. We'll be right back.
And welcome back to Maximize Living with Dr. Patrick Andersen. So Dr. Pat, we're talking about sleeplessness today. I don't think there's anything more frustrating for people. How many people are suffering?
Well, it's a huge problem. 1/3 of all people don't sleep well on any given night. And 60% of people have a sleep disorder at some time in their life. It reminds me of what Warren Zevon said. He said, "I'll sleep when I'm dead." But I noticed that he only lived to be 56 years old, so sleep is a pretty important thing.
Well, that tells you something.
It's a $90 billion a year problem, and it's because there's absenteeism, loss of work, and accidents. There's actually 12,000 people a year die because they're falling asleep at work, causing accidents, inattentive. 10% of people have chronic insomnia, and that's, I mean, they just really have difficulty sleeping at all. 9 million people take sleeping pills. And these sleeping pills have been shown, Peter Breggin, a Harvard psychiatrist, said the sleeping pills will actually cause chronic brain injury. And they're known to affect memory and digestive issues. So it's much better to work with natural remedies, natural methods, than relying on sleeping pills because they're so addictive. And then 12 million Americans have sleep apnea. And this is where the airways close at night and they can wake up with a snort or stop breathing multiple times in a minute. And there's decreased oxygen. So with decreased oxygen, there's been shown to be an increase in cancer in sleep apnea people. 4.8 times more cancer in someone with sleep apnea.
Wow. So
it's just huge. And then sleeplessness leads to depression as well. So it's a huge issue, and we spend 1/3 of our lives sleeping.
So we all know sleep's important, but why so? What really happens? Your body's rejuvenating?
Exactly. Your muscles are restoring, your hormones are rebalancing, your tissues are rebuilding, your memory is storing. So if you don't get enough sleep, you have memory issues often.
So what are some types of sleep problems? You mentioned sleep apnea is one.
Well, there's 3 primary categories. One is called insomnia, which you just have trouble falling asleep. You can't get to sleep. The second one is disturbed sleep, where you fall asleep but you wake up. And the third one is restless sleep, where you're sleeping but it's just very poor quality sleep. So you're waking up tired and it's pretty hard to move on with your day. It's kind of like torture to go on with your day when you just didn't recover from yesterday.
How awful, and no one wants to live this way. I mean, what's really causing this sleeplessness for people?
There's a lot of different causes. Post-traumatic stress disorder, arthritis, gastrointestinal problems, eating too late at night, poor sleep hygiene, emotional disorders, being upset, having an argument before going to bed. All those things can upset sleep. So there's really quite a few things.
So you hear about get your 8 hours a night. I sometimes feel like I need more. I mean, how much sleep do people really need, or how much sleep do people get?
Yeah, well, it's recommended 7 to 9. Most people are around 7 to 8, but actually the average is 6.9 hours of sleep a night.
Not enough.
But it should be a little more. About 7.25 works pretty well for most people. But it's interesting that newborns to age about 5th grade, they're getting an hour to 2 hours too little of sleep, and it's affecting their performance.
Wow, and that's hard to get those little ones to sleep too. There's just too much fun, too much to do.
Yeah, it's too much excitement.
Can you catch up on weekends? Because I'm sure I'm not alone in liking to do that.
Yeah, well, you can catch up just a little bit. You can't go all week without sleep and then sleep through the weekend. It really disrupts your whole circadian rhythm. It affects your spine. Some of the people that get worse are that are laying in bed too long and their spine starts to bother them. I remember one lady, because of her spine, she was sleeping 12 hours a day.
Wow.
And she actually got depressed from laying around too much. She didn't get her body stimulated.
It's funny how you just need that exact right amount. We're programmed for...
It's quite fascinating. In a study, there were 70,000 women were evaluated, and if they got less than 5.5 hours sleep, they had 59% higher heart attack risk. But if they had more than 9 hours sleep, they also had a higher heart attack risk. So it's important to keep that sleep in a 7 to 8 hour range.
Well, very important. Stay tuned. We have more on sleeplessness right after this. Welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about sleeplessness today. So what happens to the body when you don't get enough sleep? We talked about how most Americans aren't getting enough sleep.
Well, you know one bedtime story, Snow White and the Seven Dwarfs? You become sleepy, dopey, and grumpy all at once.
Not the pretty Snow White.
No, it increases your cortisol, which increases stress. Increases depression, you become more accident prone. Your immune system is dropped very quickly, about 50% function in immunity. So it's much easier to get sick. Your concentration go down, your anxiety go up. And it's interesting, a substance, a hormone called leptin actually goes down. Leptin tells you when you're full.
Oh.
So, and then another hormone called ghrelin, that goes up. That tells you when you're hungry. So the average person in a study in USA Today is eating about 300 more calories a day because of these hormone changes from sleeplessness.
So are you saying now that we can lose more weight by sleeping?
Sleeping better, absolutely.
There you go.
Undersleep, it's easy to gain weight because of the stress.
So there's different stages of sleeping. Can you describe those?
Sure. The first stage we call light sleep. And that's 5 to 10 minutes. And it takes about 7 minutes to go to sleep for the average person at night, unless you have a sleep disorder. This is where you feel yourself drifting off and your muscles relax. And you have alpha and theta waves. These are the same waves you get when you meditate. You get more alpha waves when you meditate. So it's a calming, and you may feel a feeling of falling. This is where you might get the muscle twitches or contractions. And you can also have something called hypnagogic hallucinations.
Ooh.
This is where, isn't that a big word?
Yeah.
Someone's calling your name, or the phone is ringing, or there's something, you hear noises, and it's actually a hallucination. And I remember as a child, I was scared to death. Now I know I was in this stage of sleep. I had a skeleton in my room, and he was scaring me for several nights in a row. And my parents finally said, just punch him in the nose. I know we don't advocate violence, but at 7 years old, I punched him in the nose and he didn't bother me anymore. But that was a hypnagogic hallucination.
If only
and
you
people
know
hear
that
all
then.
kinds of weird names. Just when they're falling asleep, they'll hear all these weird noises.
Wow.
And that light sleep lasts 5 to 10 minutes, and then still you go to another stage of sleep, stage 2 sleep, and that lasts about 20 minutes. This is where your heart rate goes down, your body temperature goes down, you totally relax. And it's the last one before stage 3, where we go into a deeper sleep, 5 to 15 minutes in this stage. And this is where you get a slow wave sleep. You get what we call delta waves happening. This is your delta sleep. And you're really groggy and confused if you get woken at this time. And the next stage is stage 4 sleep, or deeper sleep. And that's 5 to 15 minutes, even up to an hour. And it's a much deeper stage of sleep. It's the deepest sleep we get all night. And it's hard to wake someone during this. But this is where bedwetting occurs. This is where sleepwalking occurs. And this is where night terror occurs. I don't know if you've ever seen someone with night terror, but it's horrible. I had a patient who had night terror 4 times a night. He'd wake up feeling like someone was killing him, screaming. And obviously his wife was a nervous wreck hearing this all the time.
Right.
But I've had a number of cases of this in my office, And as we adjusted their spine, their sleep terror decreased significantly.
Wow, and that changes their life
It
entirely.
changed their life. So I can't say that everything is going to happen that way all the time, but I've had enough cases of seeing that change where it's really worth looking into. There's something stimulating that brain, not letting it sleep properly. So the last stage is stage 5. It's called REM sleep. We've heard of that, rapid eye movement sleep.
That's the one you always hear about, yeah.
It's paradoxal sleep because your body's actually more active. Your heart rate's going up, your blood pressure's going up. And this is where you dream. You dream during this stage, and your breathing is increased. But there's something quite interesting that happens there, is that while you're dreaming, you could have active moving, running, jumping, flying, and your muscles actually are paralyzed during that stage of sleep. And the body is amazing how it does that, because if they weren't, could you imagine having a dream that you're in a fight or flight situation, and you're next to someone and you're starting to flail your arms? It's quite fascinating how the body basically paralyzes that during that stage of sleep.
Or jumping and flying, that probably wouldn't lead to good things.
No, exactly. People have been known to crawl out windows, during that stage 4. But you cycle through these stages of sleep 4 to 5 times all night long. And then the earliest stage, again, stage 1, is when we wake up.
Very fascinating. Well, stay tuned. We have more on that right after this. And welcome back to Maximize Living with Dr. Patrick Andersen. Dr. Pat and I are talking about sleeplessness today, a disorder which affects so many people. You mentioned a lot of people are taking sleeping pills.
9 million people take sleeping pills. And most people realize they're highly addictive and they cause issues digestive-wise, but also shown to cause chronic brain injury, like many concussions. It's very hard to take that on a regular basis. But it'll cause memory loss. It'll even cause, some of the popular ones will even cause morning agitation. So you could wake up in the morning after taking a sleeping pill and you're just agitated, and you may have a fight with your spouse because you're agitated from the medication. People who take sleeping pills have an almost 5 times higher chance of dying in the next 2 to 3 years.
In the next 2 to 3 years?
Yes, in the studies, and a 35% increase in cancer. So the reason I mention this is I think it's just really important to do everything you can naturally. And then if you have to use something, understandably so with your doctor, but do everything natural you can. That's why we want to give as many tips as we can. What's interesting too is people who take sleeping pills, they have increased sleepwalking, even recorded to do sleep driving.
Uh-oh.
Could you imagine?
That's not good.
And sleep climbing out of windows. And worst of all, sleep eating.
You wake up in the morning, where did that cake go?
And you're 5 pounds heavier, and you slept.
Oh, no.
So
that's the case where sleeping doesn't help you lose weight.
No, that doesn't. You could gain weight if you're doing that.
But you see how people, they're getting desperate, because I think there's nothing more frustrating than not being able to sleep. So they're trying to take these sleeping pills, but what are some of the things that maybe they can do that's not going to be so dangerous?
Well, there's a whole science called sleep hygiene. So I'd love to go through some of those tips in sleep hygiene that make a big difference. First thing though is when most chiropractors and their patients will say when they get adjusted, they sleep much better. I would say at least 8 out of 10 patients, their first comment is, I slept the best night's sleep I've had in a long time. And the Journal of Pediatric Chiropractic said that babies sleep much better as well. We've got great studies on colic, but just generally sleeping. Babies are fidgeting and don't sleep well, they start chiropractic care. Most of them will calm down and sleep much better, which restores and repairs them for a better day the next day. But a lot of other things, eating too late at night stimulates the digestive system. It's hard to sleep, so no dinner past 6 is a great idea, or 7. No exercise within 2 to 3 hours of sleeping is helpful because your body's too stimulated, but you can try to work with that and see what works for you. Decreasing alcohol. Alcohol really doesn't put you to sleep. It causes sleeplessness. Daily routine, your timing, going to bed at the same time, getting up at the same time is very helpful. Decreasing caffeine. And there's many sources of caffeine, especially after 3 in the afternoon. It's good to stop. Or if you're sensitive, some people can't take caffeine at all, and it'll interfere with their sleep schedule. It's the worst thing to take caffeine to wake up and a sleeping pill to go to sleep. that would be a
Yeah,
bad.
you don't want to walk down
Yeah.
that road.
And then napping is great. Who doesn't like a nice nap? But it's best to keep them before 4 in the afternoon and keep them, 20 minutes max. Otherwise, you're too groggy and it interferes with night sleep. Listen to relaxing music helps, and a warm bath calms your body down, and you can sleep better with a warm bath. Shut off electronics. Here's the tough one. The blue light from the electronics stimulates your brain too much, and it's hard to go to sleep. So really, at least an hour with no cell phone or computers on. I know that's hard, but that really does interfere with sleep. Dark room, the darker the better. Cooler temperature, 60 to 68 degrees is a good sleeping temperature. Diet high in fruits and veggies and low on junk food often helps sleep better. And toughest one is no TV in bed. Sorry.
Yeah,
there's just no good way to do TV in bed because you got all that flashing signals and blue light.
All the blue light, yeah.
And it's really hard unless your TV's on the ceiling, you probably have your head propped up the wrong way.
And some alarm clocks too, I've noticed, have got a really bright backlight. And I think that you just need to turn that light off because that seems to keep you awake at night.
It really does. And so covering that can be real helpful. That's a good point. Blocking that light, otherwise it can stimulate you.
Because it's right there by your face. Well, stay tuned. We're going to talk about preparing the spine for sleep coming up next. And welcome back to Maximize Living with Dr. Patrick Andersen. We're talking about now preparing your spine for sleep and rest and the best sleeping positions. So we're preparing the spine. How do we do it?
Well, our spines take a lot through during the day, and the joints can be torqued or stiff or tight muscles, little inch-long muscles and very tight. We want to loosen those up before we go to bed at night, because that's going to help you sleep better. It'll shut off those sensory signals that could be agitating your brain and keeping you awake. So the first one is a flexion extension exercise.
Okay.
Where you just arch your back, or slouch your back, and then arch forward. And you do that about 20 repetitions, going back and forth. Exactly. And that'll loosen up the joints in the spine. The next one is a side bend where you put your arms up for a little leverage, and you just tip to the side. And you do 20 repetitions
Bang
of that.
into you here. But yeah, it does.
And you relax the neck and the mid-back as you do it, so you can really open up those vertebrae and get good circulation into the discs. This is very helpful if you have disc degeneration, to get fluid into the disc. The last one for warming up is a rotation exercise. Hands up here.
Okay.
And you turn your head as far as you can and rotate side to side with a good arch in your back. And we can do 20 reps. Then we warm the spine up. And then what we do is we use the spinal molding that we showed you earlier, the rolls under the neck and back to go to sleep at night. And then when you're done with the rolls, you can go to a normal pillow.
Okay.
So one of the things I wanted to point out with a pillow is look at the posture here if you sleep on 2 pillows.
Allow me to demonstrate.
Yes.
I'm lying down on the job here.
And you can see where her head is pushed way forward. And if you're trying to read in bed, this is a common posture. Or if you're watching television, your head's propped way up, and it's really hard on the neck. It can cause neck pain and headaches, and it's not a good posture to stay in. So
yeah,
we want to not do that. So the best position is to sleep on your back.
Okay.
Now, a lot of people aren't comfortable on their back. One of our goals in care is to get the spine right so you can sleep on your back, because it is by far the best position. And you can put a rolled towel or a pillow under your knees. That sometimes is comfortable for people. The next best position is to sleep on your side, and that's completely fine. If you'd go ahead and roll that way. And in this position, you do kind of want to have a little thicker pillow. You want to either bunch it up or have a different pillow you use. And the idea here is to have your head level with the rest of your spine, not propped up too high, not hanging down too low. Sometimes on side sleeping, your arms can go numb, so you might vary your position, lean back a little more, vary that a little bit like that. And then a pillow between the knees often helps so that it is not a scissoring or a twisting of the spine very much. The worst position of all, though, is stomach sleeping. If you sleep on your stomach, your lower back gets arched too much, and your head is turned. and that torques the neck. Imagine walking around all day with your head turned one way. That would probably not feel too good, and people might think you're strange if you did that all day.
Yeah, exactly. So we're done sleeping now. I just kind of popped up.
You didn't do that well.
Yeah. So if I'm truly sleeping, let me get back down
when
here.
you get up in the morning, go ahead and lie on your back. A lot of people just jump out of bed and their spine's really not very warm, and it's easy to hurt. Some people almost try to levitate out of bed.
They do.
You get a swing with their arms to get
Attack
up.
the morning.
But a better way to get up is to roll to your side.
Okay.
And then let your legs come off, and then push with your elbow and your hand. And it's a very easy way to get up and let that spine wake up. And then it's a great time to start doing those warm-up exercises, just like we did at night.
This one.
The flexion extension,
And
the rotation, and the side bends, yep. And then you're ready for your day.
you're ready to start your day. Maybe throw in a little meditation, right, Dr. Pat?
Meditation, you bet.
Well, stay with us. We have more coming up right after this.
Welcome back to Maximize Living. I hope you found our sleep show useful. If sleeplessness is all too often part of your life, I recommend you call Madison Maximize Living at 608-833-1282 for a thorough evaluation. As a board-certified chiropractor, I've helped thousands of people with poor sleep postures, sleeplessness, and sleep hygiene over many years in practice. More than occasional sleeplessness is not normal. While no one can guarantee results, most chiropractors and their patients report significant sleep improvement with chiropractic adjustments. This is also true in pediatric studies on infants. Both infants and adults sleep better with chiropractic care. Call 608-833-1282 and let's see if we can help get you back on the road to better sleep. For Maximize Living, I'm Dr. Patrick Andersen. Until next week, live well.